Okay, the record is on, and now I'm starting. Um, so I'm very happy to have you here today in our uh, unusual, but I think kind of interesting format of meeting. Today is our first meeting about public health, and the first lecture will be mostly general and introductory. We will focus on about the course, what public health means, and we will focus on of current situation, which is kind of result of public health action, and we will focus on also about the course contents, course schedule, and so on and so on. Okay. Then some information I will provide to you about first topic, and then we can finish and then start more deeper about topics from the second meeting. So, but the most important thing for introductory course and for first lecture is to realize the importance of subject and is to realize the fact why it could be beneficial for you and how this process can contribute to your professional development, to being a doctor or public health or medical staff in the future. This is important question. We are not providing, I'm not going to provide anything without discussing and realizing the importance of subject, and I'm not going to provide anything just because the somebody or course program told us that it's essential. So the first important thing is that we should fully understand, and you should fully agree with me. And now today, my dear students, I have a strongest goal to convince you about importance of public health, comparing with other previous semesters. And that important tool is called real life COVID-19 virus, existence of COVID-19, which will turn inside out Hey guys, I think I'm back. Yes? Yeah. Okay, guys. Good, because that's a technical thing. I was kicked off from the program accidentally. Everybody hear me, am I right? Because I see some, yes, okay, okay. Let's do not lose time about that. So, what I was trying to tell you, dear my students, is let's together analyze importance of public health globally, locally, and professionally. Um, the importance of public health globally is on the top. When I mentioned, we will also talk about a lot, and we will provide during the course a lot of examples comparing the public health with the current situation regarding the pandemic process in the worldwide happening. So, but today, very shortly, I can say that the importance of public health globally is on its absolutely top level, visible, and we feel it every day. Every person, professional, medical, unprofessional, non-professional, non-medical staff, every nation feels the processes and importance of public health. So the public health, what I will try to explain you during the whole course is that the public health is not a matter of medical professionals. If we want to achieve success in public health, all directions, all institutions in a country and in a worldwide should stand together. So all the limitation what is exist today, what we see today, it is not the result of this is not a result of medical professionals or Ministry of Healthcare. This is result of central government agreement. The stopping the school process, make the lockdown, make all the limitation, working in emergency, all the thing comes from different institutions, comes from police, comes from and solve this public health problem, which is pandemic of COVID-19. This immediately became a matter of entire institutions, whole government, and head of the governments and world institution like a United Nations, World Health Organization, and so on. So we need to see that public health covers much more wider range of direction rather than medical sphere and medical world. So of course the medical world and medical sphere is a pioneer in a public health, but only medical world cannot achieve any goal. So, and even guys, if the governments issued a very strict limitations, if there is no public consolidation, public solidarity of all people and population, the public health issue, like stopping the spreading of pandemic infection diseases, could not be successfully achieved. So, starting from the president or prime minister of the country, ending up to one single citizen, all of the people, all of the institutions are involved in public health issue, and which is visible today. And you don't need to, I don't need to provide a lot of specific examples. You see that every day in your news. What is happening today, my dears? What is happening today that there is some joke that everybody became a doctor. Sometimes the professionals are kidding. There's a joke that everybody became a doctor. The President of United States of America reporting almost every day about current medical situation in a country. Do you see the power of public health? Yeah. So in early situation, maximum in ordinary country, it should be published and announced by the Ministry of Healthcare or some institution, representative of professional medical institution. But during the pandemic, an emergency outbreak of coronavirus. So we see that all of the people the president is reporting, or prime minister is in Georgia happening that reporting, and after the prime minister, of course, the professionals are reporting. So, and we are the whole world asking and whole world we are asking people, the citizens, to stay at home. That's a slogan. So it's connected and contacted to every person. That's what I'm trying to show you, the wideness and globality of public health issue, especially today. Now go to more narrow thing before I share to you the presentation. I'm just doing the introductory. And now to go into narrow and analyze why public health could be important for you when the pandemic, I hope, over soon, and we all go back in our usual daily life, and you all continue dreaming about to become a different, the direction of different doctors, surgeons, pediatricians, internal medicine, and so on. How, in that manner, public knowledge of public health can contribute and rise your professional knowledge as a professional doctors. We will almost every lecture highlight this issue, but very shortly I can tell you guys that public knowledge of public health in not only public health does not mean only pandemic of epidemic and communicable diseases. Also public health means and study non-communicable diseases like cardiovascular diseases and other different diseases, which is considered as a first killer in the world. It's called the vast majority of the world population are dying from cardiovascular diseases. It's called first killer. So and this is a non-communicable disease. This is not kind of, virus which is spreaded so fast like COVID-19. But in that way, the public health analyze those diseases and those problematics from absolutely different point of view, from absolutely different side. So in ordinary situation, doctor, when he tried to make diagnose to his or her patient, mostly the doctor is focus on the blood test, focus on instrumental survey, focus on different things, which is all the things are clinical, and the public health is the thing which can help the doctors and nurses to make a diagnose and deep diagnose and treatment plan, which is important. The most important here is a treatment plan, guys. To make a treatment plan based on the statistic of that diseases, development of that diseases, and analyzing the source of that diseases. Very simply say, the doctor can give, let's imagine that you are internal medicine doctor, like pulmonologist, and you have a patient with obstetric pulmonary diseases. Young guy cannot birth. So the doctor without public health knowledge will focus only to this disease, focus to this pain, focus to clinical aspect of that disease and give the medicine. But what you realize is that after a few days, your treatment plan of the medicines and the clinical treatment is not successful. The patient is getting worse and worse. And based on your protocols and clinical guidelines, so you see that you do everything correctly, but you cannot receive any result. What is happening? So I'm providing you guys the real example which happened in my professional career. And I'm very sorry, I just forgot to produce myself, and I will do it when I will finish this moment, this example. So, and the patient getting worse. After the deep conversation and discussing, you will realize that this young guy was working in a car paint shop where they're painting the cars and having everyday connection with aggressive paint chemicals, even with respirator. So the only mistake the doctor did in that case in his treatment plan is that they ignore environment of the patient, to take patient out from that harmful environment for him. And they ignore the specificity, statistical and other public health specificity for that particular non-communicable obstetric pulmonary diseases. The doctor only focus to clinical aspect. And if you do not take off patient from the causing reason of that diseases, of course, you will not be succeed. And that is important. And public health, knowledge of public health will widen your view towards diseases and towards all the things to be more successful and to look to your treatment, to the patient from absolutely different front point of view rather than clinical. You should consider all these directions, dear students, all these directions. That is, to be a successful doctor, it's very, very difficult. You have to have very wide range of thinking and view. I just make another example of non-communicable diseases for your professional career and development. But about the communicable diseases, there is no doubt and there is no discussion how important is the knowledge of public health during epidemic or pandemic, when all the doctors forgetting temporary their profession, the neuro profession, and the surgeons and the pediatrics and an anesthesiologist, all they are working together in ICU against coronavirus. In that manner, in that particular manner, the knowledge of public health is crucial, I would say, and not only I would say. Now the people, politicians, the NGO peoples, other representatives of civil society, they are now sitting down and reading the basics of public health to understand what is going on in the world. What is vaccination? What is the treatment? What is the chain of spreading of diseases in that communicable pandemic case? The unprofessional people are reading this today, trying to analyze. But of course, for professional people, it's the crucial. And also it's crucial because when you are working for example, in your hometown, God save your hometown again, epidemic case, but if it happens, and it happens almost all over the world, so you need to also carry out the role of educator, role of patient educator in your hospital. Despite and no matter, there is no matter which kind of specialization you have if you're a doctor. And in that manner also to explain to your patient, to explain to your community the public health, knowledge of public health is very important and crucial. So I suppose very shortly, there was one question I see. Come on, guys. I just starting the talking with you and somebody asking the first midterm and presentation. You are far away, I think, from this midterm. But if the question comes, I will now let me to introduce myself and tell briefly about the course, not content, but this technical thing, which is, I don't like. I'm a Georgi Beria. I'm a professional of public health and health management. I also lead the Clinical Skills Laboratory and Training Center of New Vision University. When you have a clinical skills, you will come to me in, I hope soon, in a 5th floor with mannequins. And I also was leading the chain of hospitals in Georgia in a big corporation. And I'm also leading the one big hospital today as a fever clinic against COVID-19 pandemic. So now about the course. So you can guys go to your drive. Early it was the drive, I think nothing has changed. And syllabus is uploaded to your drive in a Google Drive. And you can ask to School of Medicine also if something wrong here. And in the syllabus, everything is visible. All topics. When you have a midterm, you will have a 2 midterm and 1 final. After 5 or 6 topics, I think after 5 or 6 weeks, you will have a first midterm. Then after 5 or 6, another midterm or something, and then final. It totally contains 12 topics. So nothing special. And these finals and midterms are, MCQ. So there is no practical, they're theoretical. Mostly the 70% or 65, something like that, the questions come from presentations, and 40%, 35-40% comes from book, which is also uploaded in your Google Drive. And book is very, very, very simple. It's very simple book with simple language, because the presentation is not fully. There are some only points written in presentation if you want to understand. And the most also important, the thing is my lecture, because when I'm talking something, I'm explaining one thing, and on the other hand, I'm also make a focus and I'm underlining the important issue which you need to focus on during your study process. There is only one book, dear students, here in your drive. It's called Introduction of Public Health. So it's a blue book. Okay, now let me to share to you. Okay, let me to share the presentation. I hope you see the presentation. Let me to show you that things. Just 1 minute. I need to make on the entire screen, and that will be okay. Okay, but it disturbs me. I need to ignore it. I don't need this to be notified. Just 1 minute. It's my first time. I apologize. The next time I'll be more faster. Okay, but I think it's also visible here like that. Yes, am I right? There's only one disturbing me one thing. I cannot ignore this notification which disturb me to make it entire. Okay. So, okay, it's fine. I see your message that it's fine. If it's fine, we don't need to lose a lot of time to make this presentation on a full screen, because this is one small. Oh yeah, it's over. Now it's better, I think. So this is the general concept of public health, which is okay. And now let's go to focus on terminology of public health. So the scope of public health and what public health means. So let's read this explanation from World Health Organization first, and then translate it on our simple language, the analyze. The public health is the sense and art of preventing disease, prolonging life, and promoting health through the organized effort of society. And if you see, guys, the phrase organized effort of society is underlined. I did that because, do you remember in a few minutes ago, I was explaining you when I was explaining something about COVID-19 pandemic, that the public health issue and COVID-19 concerns to everybody, from president and the first leader to the country to ordinary citizens. And nobody can achieve any result in public health. None of the army, none of the police and limitations and strong hands, so-called, if there is no solidarity from all the people, and if there is asked to stay at home, they must stay at home. So that is organized effort of society. The organized effort of society is organized effort of all institutions working together against pandemic. So to go back again, the role of public health, also the preventing disease. What does it mean? Before the COVID-19 appears, we know from our history that there was the several very aggressive infections in the world, like Black Plague, which killed in Europe half almost the population, and the beginning of 20th Spanish flu and poliomyelitis and so on. But this Black Plague, poliomyelitis, and other aggressive infection diseases which took a lot of life, sometimes more, rather than First World or Second World War, disappeared, and now it's part of the history. What's happened in the world? How it's possible that they disappeared? In the world happened the process which we call the vaccination and immunization. After the vaccination, the world society generalized immunity against Black Plague and poliomyelitis. So, and why I mentioned that, guys, that the process of vaccination is a preventing diseases, is a process of preventing diseases. What prolonging life means? Let's go back to communicable diseases and say a few words about cardiovascular diseases, which is, as I mentioned already, it's a first killer. What makes mostly these cardiovascular diseases like heart attack, like stroke, like all the problems and disorders related with vessels make so popular and so common in world population, guys? That's very simple. Answer is very simple. One of the big act and so on and so on. Diseases. It's an action which helps population and people to prolong their life. Okay, let's go back to history and say, do you know, guys, what was average life expectancy? How long people live? 100 years ago or 200 years ago, it was approximately 55 years old or 50, in some ways 60. Average 55 years ago. When we take an average 55 years, it means that somebody in his 14, 35, it's under the big risk to die. What is life expectancy in Japan? In Japan, it's the highest life expectancy in the population. 80, which means average, they have a lot of people with 19 years old and 100, and also 17. So in that way, something happens which helps humanity or some population in 200 years or something rise their average life expectancy and prolong their life so high. This is public health. This is non-smoking lifestyle, non-drinking lifestyle. This is healthy foods. This is healthy lifestyle and a lot of things. And this is the public health actions, less infection. So what I'm trying to tell you also, guys, that don't consider you are the professionals tomorrow. Don't consider the disease itself appears from nothing. The sky is opening and disease comes to us. It's not happening. Every disease, communicable and non-communicable, I mean, under the communicable infections like COVID-19, like Black Plague, like Spanish flu and others, any others, malaria and any others. This is a communicable disease which is spreaded like infection, not lightened as an infection. And non-communicable diseases like a lot of cancers in the world, the cardiovascular diseases, this all is a result of our unhealthy behavior. So we do something wrong, and then this disease arises and turns back to us very negatively. So, and even in that COVID, the history, this is not 100% proved, but this is in that Wuhan region in China, this is unhealthy contact of animal and human. Even in that Ebola, early, very aggressive diseases. It's also related with monkey in sub-Saharan Africa, and also unhealthy contact. And what is the goal of public health? The World Health Organization, this is WHO, which I think you already know, and you see a lot of everyday briefings and press conferences from WHO is health for all. What does it mean? The biologic, physical, and mental well-being of all members of society, regardless of gender, wealth, ethnicity, sexual orientation, cultural, political views. So very shortly say what this health for all means. Guys, what I want to tell you also, to be a healthy, it is your right, like your right to be a free. If government make sure to do something, some actions to help his population be healthy, or try to give the accessibility to health care, we should not consider that government gives us the gift and we should say every day thank you. We elected this government, we give them the salary to organize three things mostly: our freedom, our health, and our development. The health is a right. And if front of the law, poor and rich, politician and some the agricultural worker, everybody is equal. The World Health Organization tells us that in terms of health also, everybody equal and everybody has a right to be healthy. And government should work for it. If it not happens like that, if we make a very strong and aggressive differences and parting in health, what would happen? What do you think, guys? What would happen? There would happen the Wuhan things again. Wuhan scenarios again. It starts from poor people in Wuhan market and came to Boris Johnson, the Prime Minister of Great Britain, in 2 months. Imagine. I do remember, I'm sure that my previous classes in the last semester, which are our students still, somebody of them will remember my words before absolutely this COVID-19 appears in the world. Exactly the things that if we not make sure health for all people, that will have and may have very fast chain reaction, especially in epidemic and pandemic, where this infection diseases is arising. The infection diseases arising in a poor population mostly, and in a place where sanitation, the sanitary and hygiene and all the thing is not followed at all, and it's spread it very fast. So even in case of non-communicable diseases, why it should be health for all? The health for all, it should be and must be, because if we want to make nation very poor, we should let families to have unhealthy members, at least one unhealthy member who is feeding his family in our families, and it's destroy families and it's destroy economy. Only healthy and educated nation can make a big future. It's not my thing. It's a saying of very famous um, health worker, Avedis Donavedian. And equality in health, the right, it's a crucial. Otherwise, this will come back to everybody, to government, to nation, and to all the people. And what is the function of public health? So our next slide. Let's just read it. Talked about, yeah? So identify, measure, monitor, and anticipate community health need, surveillance. Oh, that's the important thing. What public health workers are doing, even today. You see a lot of news is that epidemiologists go there, epidemiologists start investigation, epidemiologists realize that this is a public health function when they identify, but before it happens, the public health function would be effective, guys, if public health workers do measurement, monitoring, and anticipate of community needs to make a prevention, to see the risks, to analyze the risks, and make actions before exposure happens. This is very important thing. Or in case of non-communicable, non-infection diseases, to see the specificity of some community or some environment and help this community. For example, in Georgia, in the mountain population, in the mountain water, there is a leakage of iod, the iod deficit, and it's directly affects on mental development. So this is a special community need in high mountains water, what they drink. And a public health action is to give them additional, or let's take a vitamin D. In the north countries, where the sun comes very shortly in the time period of year, the whole population suffers from the shortage of vitamin D. And a public health action, it should be and must be the create an action to help their people and population with vitamin D in order to prevent the lot of diseases then developed from the deficit of vitamin D. That is the third point. Investigating the fourth point, the function of public health is to investigate and diagnose health problem, including microbial and chemical hazard. We also talked about that. Formulate, promote, and enforce essential health policies. Oh, come on, of course. Essential health policies and actions and strategies to create where we go, what should we need to achieve to make a prevention, and to answer on that things, to prevent diseases, prolong life, and promote health, That one. Then 6, organize and ensure high quality, cost effective public health and healthcare services. Of course, in everything, it is essential to make cost effective on one hand and also high quality actions. And what is it, for example? The early prevention of aggressive not genetic, I would say, but chronic diseases such as diabetes, such as pulmonary diseases, such as even cardiovascular diseases. All those can be prevented or, how to say, managed in early development if we have cost-effective public action. And in later on in our next lectures, I will provide more specific examples what the primary healthcare means, the first level of healthcare, when public health institutions create effective early accessibility in a primary healthcare, family doctors, through the family doctors. And if you have a just simple high blood pressure, and if the public health action is effective on a primary early level of on your high blood pressure, with one small simple medicine to regulate your blood pressure, with your education to follow your healthy lifestyle, I can prevent your heart attack, I can prevent your stroke, I can prevent your diabetes, and I can prevent a lot of aggressive killers or chronic diseases which will make you half effective in your life, and you always will need lots of expensive treatments. So this is cost-effective policies of public health. High quality and cost effective. This is a small example, then we'll go more deeper next time. So what we have next, reduce health disparities and ensure access to healthcare for all. Yeah, about a healthcare for all, we mentioned a lot previously. I will not stop here. Promote and protect a healthy environment. What do you think? How much we make a lot of export, despite how much and how many effort and strategies we make. If we live in pollution air with a lot of cars, killing us every day, giving us a chemical dose in our blood. If we drink every day, and especially in megapolises in the big cities, unhealthy water. If we drink biochemical food, how our health can be achieved? The most important thing here, together with actions, together with planning, together with accessibilities, in even our healthy lifestyles, is health environment. And the public health action is also. That is why the matter of public health also to ensure the health environment. That is why I told you in the beginning of my in my lecture that public health, to achieve the high quality public health for all, to hold people and nation to have you healthy, only Ministry of Health could not achieve this, and health professional could not achieve this role. So, and this is the same example. We have a right to live also in health environment, because the health environment is one of the important defining issue and defines our health. Disseminate health information and mobilize communities to take a protection. So the patient education, the thing which is happening today, every day, information of population, information of people, but not panic them. Plan and prepare for natural and man-made disasters. So let's keep that for a while. Later on, it will be clear for you. Reduce the it's very clear that reduce the impact of violence and aggressive war. Yeah, sure. They conduct research and evaluate health promoting, disease preventing strategies. Yes. Early research from prevention, research for vaccination, research for treatment, research for specific needs of population and community. Of course, it's the most important thing for public health. Otherwise, we cannot achieve the things health for all. This is not particularly health for one particular patient having one particular problem or another problem, but it's still specific health issue. This is things related to all the peoples, the communities. Develop new methodologies for research and evaluation. It's the same, and train, ensure a competent public health workforce. Training. This is most important thing, I think. Contemporary public health issue, poverty. So very shortly, I can tell you guys that we have one slide, as I remember, the next time when we go through deeper in our course, the poverty, the number one enemy or number two enemy for public health, poverty. So here is one statistics that more than half of the world's population lives below the poverty line. 22% of the population in developing countries lives on less than $1.25 in a day. And I just want you to think for a second. I think it will not be difficult for you to guess why should poverty be a number one or number two, one of the top enemies for public health. Poverty. Less accessibility to environment, healthy environment, less accessibility to healthy food, less accessibility to healthy lifestyle, less accessibility to all the things which makes you healthy, and also bad sanitation, bad hygiene, which makes and which is one of the important defining issue to arise infection. If you tell me that in that terrible Wuhan market, rich and educated Chinese people were walking and buying these terrible things and eating, I would argue with you. So here is this is a little bit old for now, I think old, but 3 months ago it was not old, but I think now the lots of things after the COVID-19 pandemic will be racing and changed, and especially it will be it will be related regarding to public health, but the main idea remains the same. And what is main idea you see here in that presentation? Let me turn turn off the light. So the main idea here, we see that in the beginning of 20th century, before vaccination as a community immunity has been created, or not created, but coming so popular, the first killers was infectious diseases. Even today, despite already almost 3 million people died from COVID-19, the COVID-19 is not first killer. Not. The aggressive alarm is ringing in the world because to make prevention and stop this process. Otherwise, if we let this infection to go, it can become first killer, but it is not, definitely not 3 million people. Spanish flu took almost 50 or 500 million lives in a beginning of 20th century. So what I'm trying to explain you here, the main idea, you can see the numbers here on any other place in the internet, it's not a problem, is that after the vaccination, after the antibiotic, after the development of science and medical researches, the infection diseases a little bit turned back and non-communicable diseases came front, like this diabetes, the cardiovascular diseases, the strokes, cancers, and so on. But we don't know how long COVID-19 can be last, and how this infection will react, and how the development of science, which is much more developed rather than the beginning of 20th century, can respond, how fast it can be response adequately, inventing the vaccine, inventing the treatment. The COVID-19 turns out all the things. We don't know, we can't say something today, but this picture remains still popular. In causes of death, in 2011, for example, it's this is a second rows table. It's the first time, the first place is ischemic heart diseases, 7.0 millions. Another stroke, which is also cardiovascular diseases, 6.2 million. This is one year. Lower respiratory, 1 year of 2011. Lower respiratory infections, and so on and so on. You can see all those are non-communicable diseases. But early, it was, is it visible? I don't know. Yes, this is a leading cause of death in 19. Yes, early it was mostly infection diseases. The main treats threats of spreading communicable diseases. So I talked to you about the communicable diseases. A little bit run forward, and we can skip this because it's the same. Factors contributing to the emerge or re-emerge of infection diseases. Yes, it's also the same. Don't pay focus so much on this terminology, emerge and re-emerge of infection diseases. We will have separate lecture to explain all this terminology when we go to communicable diseases. But so far, the main idea of this slide is that the cause of communicable diseases like infection is a poverty, is a bad sanitation, bad hygiene, a less education, the effectiveness of spreading of why the disease is sometimes spread so fast. It's also importantly depends on disease itself, the specificity, the microbiome specificity of spreading and contagion. But still, the living the lot of people in small area like crowded urban area like New York, why it's happened here, it's defining reason. Also less education of people. You see the from your TV, I do believe the lots of information campaigns to wash your hand. So there is some jokes and people in a 21st century learning to wash their hand. So and the human behaviors, to say in one words, and environment, physical and also the micropsychological environment. Those are most important factors of spreading of communicable diseases. So do you see this here? The non-communicable diseases, the world map, developed and developing cardiovascular deaths in the main cause of death, chronic diseases like diabetes type 2 and so on. 10% of the world population suffers from mental illness also. Oh, this is another big issue for public health. Now a little bit forgotten today. So injuries and so on. So you can see, guys, in the first map, death rates per 100,000 population. As darker is the color, as higher is the number. So if the absolutely white is less than 400, and that comes from 400 to 500, and the darker blue color in a map means more than 900, imagine. So when you see the Russian region, kind of our region, Africa, and so on. So this is from NCD, National Central Diseases Research. So it's, yeah, actually we finish our introductory course, and now let me to go back to your unshare this one and the presentation and see the questions. Stop presenting, stop sharing. Okay, so there's a lot of questions. Somebody asked me about 666, and I cannot take it serious. Here's the syllabus for the first midterm 1/6 week, and the rest 6/12 week second midterm. Guys, I don't remember exactly when the midterm is written in your syllabus. The above topics above the midterm will be included in that particular midterm. Okay. So I don't remember exactly in your syllabus. It's after 5 or after 6. Look on it in your drive. Don't lose my time for it. So let's see another. Go back, sense, but I still can symbols at the same time. Eat, drink, smoke, do drugs, or live healthy. Eventually, you will die. Okay. I don't think that the microchips that they will implant all human after the coronavirus pandemic. Oh my God. What kind of microchips? Guys, so I don't know what is the source of this information, but the microchips cannot help humanity against infection diseases. No, absolutely not. And I don't think that any official declaration of World Health Organization, of American Central Disease Institution even generate this opinion. So I cannot answer to this question evidently. They eat, beach, soap, and sneakers. What the hell, please have to stop sharing. But of course, in high-risk areas of bad hygiene, lack of portable water, the evidence of wash your hand can't exactly be implemented. Yes. What are your thoughts on 5G? Okay, now one question. Thank you for your question about 5G. Very, very shortly. This is absolutely an evidence. I cannot explain. So there is no serious. So sometimes when something happens, there is some scientific discussions. Scientific discussion happens when even one serious reason exists to the idea, scientific, medical, scientific reason exists to the in the idea which is generated. In the 5G, there is no any scientific reason for that discussion. Just look on that countries. Let's take the Russian Federation, where the coronavirus spreading very aggressively, and very soon you will see the Russia on the top of the thing. Now let's take Wuhan region. So, and think about it, where is this 5G or this is absolutely myth, and this is not correct. And this information has its own sources, special political things. But this information is not under the discussion of any, even the very opposite scientific thinkers towards the coronavirus spreading. In my presentation, you can consider that, of course, but not in introductory presentation. This is just, as I told you, very introductory course. And what was my goal to bring it to you. I told you in the beginning, and generally we will go through about the things topic by topics. Okay, let me to read this question. In terms of corona, most of the official advice can't really be implemented in high risk areas through, such as washing hands, where there is a lack of running water. Okay. What type of public health administration could take this place in this area? Guys, okay, if I understand correctly, the shortage of this question, main idea is that how some people can afford themselves to wash hands when they do not have water or there is a deficit of that water. So, and who is responsible for it? The responsible for it is whole the government and country of that particular community or society, of course, and not Ministry of Healthcare. All the government who should make at least the basic accessibility to water. So, and also, guys, don't think that only thing like punishing is the washing hands. The social distancing is the most important thing towards the coronavirus. Stay at home. So, and in that way, we can cut the the chain reaction of spreading of virus. So washing hands also very important. Do you see what do I have here in my room? The sanitation. This is Desderman alcohol hand rub to when there is no accessibility of water or I have a meeting or I'm running, I'm using that. So in a poor area, of course, it will not be accessible and simple water, but the most important thing is to take away from the contacts, from any kind of contact during the outreach. In finals, all chapters will be included. Okay, guys, so far there is no any other questions. Thank you for your attention, and we will meet each other, I suppose, the next Wednesday. Thank you.